This presentation will focus on the Master of Science in Global Health Delivery offered at the University of Global Health Equity. The Master of Science in Global Health Delivery application is open for candidates for our incoming class starting in September of 2016. The University of Global Health Equity is a new university in Rwanda dedicated to equity, delivery science, and training leaders in Rwanda, in Africa, and from all over the globe to be excellent practitioners in the global health delivery space. It's focused on research, clinical care, and implementation. This presentation will focus on our Master of Science in Global Health Delivery, and that degree will be a cornerstone of all of our health science degrees in the future. So right now we have an executive style Master of Science in Global Health Delivery, which I'll be talking about during the presentation. But in the future, we will add a medical degree, a nursing degree, veterinary science training, doctoral studies, dentistry, and all of those other health science degrees will also include this Master's of Global Health Delivery. The university will also focus on research with a robust research agenda here in Rwanda and beyond, attracting faculty, students, and trainees who are all coming to get this rich training in delivery and implementation. The university launched in 2015. We had 26 students in our Master of Science in Global Health Delivery program. This program is adapted from a similar program at Harvard University, and as a result, we've collaborated around curriculum, around faculty, as well as teaching methodology. Students are trained in the classroom, certainly, but they are also mentored extensively by faculty here and abroad. And part of the program, a big part of the program, is a practicum project, which students complete throughout semesters 2, 3, and 4. And that's a project that they do at their work site, focused on an implementation delivery question that they're interested in addressing. The program's 2 years, taken part-time, so 1 night a week, 1 weekend a month, and 1 week intensive at the beginning of each term. There are these Rwandan faculty, these international faculty, so the teaching environment is really, really rich and diverse. The education style is problem-based, it's experiential. Students are playing an active role in the classroom. And finally, as I mentioned already, the mentored practicum. In terms of cost, the degree is $15,000, which is competitive with other health science training in East Africa at a private university. So you split this between the 2 years, 7,500 USD each year. And then you think about scholarships. So most students are receiving financial support from a variety of ways. There's the university providing some scholarship support. There's student employers providing some scholarship support. There are governmental scholarships. And finally, students are taking out private loans to help pay for their education. Here's the academic calendar. So you can see it crosses the 2 years as well as intensive January terms, which is when we do the week-long intensive. And the curriculum is designed to help students understand how did these health problems become, what they are in the first place. So what's the history of all of these issues and what social forces are at play bringing us to this point? And that course, the course that covers most of that is Principles of Global Health, so first semester. Then we figure out, well, how do we measure the problems we're trying to solve? And we do that through the second semester course focused on research. So what indicators should we be looking at? How do we determine, where to go for that information? Who to ask? What are these questions? What's important? Who should be at the table? All of these things are really, really critical. They also learn management and leadership during semester 2 in order to really implement the projects effectively. Semester 3 is focused on managing global healthcare delivery. So that course addresses operations, administration, finance, leadership, management, governance. And then semester 4 is the intensive practicum, but as you can see, it starts during semester 2. Between semesters 3 and 4, we focus on political economy and policy, also, of course, related to healthcare delivery. This is very important. How do you apply? You go to our website, www.ughe.org, where you can find the online application. You create a portal. You create a student login using the application portal, and that's so that you can log in and log out and return to complete your application in stages. You'll need your CV as well as your transcript when completing the application. And once it's finished, you'll get an email confirmation that everything is in and we're all set. One thing I would recommend is spending a good bit of time on thoughtful responses to the essay questions. The essay questions are a way for us to see more about you as a candidate, what you'll bring to the education community, what you want to do in the future. So be really specific and succinct in your answers to those essay questions because they heavily influence the admissions committee's decision about the candidates. Here are the dates and deadlines. So you see the application closes on March 4th, which is Friday. The next step is the admissions committee reviews all the applications, and the top applicants are invited for an entrance exam. The entrance exam is in Kigali, and it focuses on reading comprehension, so reading a short health-focused article and answering some questions, audio-visual comprehension, watching a short clip, and responding to questions based on what you've seen and heard. And finally, a quantitative section which tests your math skills. So all of these things we believe are really important in assessing if students have what it takes academically to perform well in the program. Depending on the score of the entrance exam, the top students are invited to come for an in-person interview, which is also in Kigali. And that'll be a short interview with a panel that's part of the admissions committee, asking you more questions about yourself professionally, personally, academic goals, working on teams, challenges, those sorts of things. And then we will make a decision and announce who is receiving offers in April. And you have a little time to make a decision. And then you get back to us and let us know if you're accepting your offer, which of course we hope you do. And finally, we start class in September. So please go online, read more about us on the website. Reach out to us with questions. Our email address is mghd@ughe.org, mghd@ughe.org. And we hope that you will become a part of the class of 2018. Thank you very much, and I look forward to your application and to hearing from you soon.